You wake up every day with that feeling. Something stuck in your throat, as if someone had poured glue into your pharynx while you slept. You swallow, clear your throat, try to clean it, and for a few seconds it seems like it worked. But a few minutes later, the feeling comes back. It feels like there is something stuck there all the time. You drink water, try to cough, try to ignore it, but the mucus keeps coming back. Sometimes this has been happening for weeks, in some cases for months. And the most frustrating part is that many people have already tried everything. Syrups, antihistamines, lozenges, nasal sprays. And even so, the problem continues. It feels like nothing truly solves it. But there is something that almost nobody has explained to you about this. Most of the time, the mucus is not the real problem. It is just a sign. A silent warning that something in your body is not functioning exactly as it should. And today, you will understand the 5 hidden causes that may be causing this persistent mucus in your throat, including one extremely common cause that many people have without even imagining it. Millions of people live daily with symptoms such as constant mucus, the need to clear the throat, the feeling of something stuck in the throat, or that slightly hoarse voice when waking up. Many think it is just a poorly cured cold. Others believe it is an allergy to weather, dust, or air conditioning. Some even think this is normal with aging. However, in many cases, the real origin of this problem is something completely different from what most people imagine. Before talking about the causes, you need to understand something fundamental. This completely changes the way we see mucus. Mucus is not an enemy of the body. In fact, it is an extremely important protection mechanism. The human body produces almost 2 liters of mucus every day. It sounds like a lot, but normally you do not even notice it. This mucus forms a protective layer that covers the nose, throat, and respiratory pathways. It works as a natural filter, capturing dust, viruses, bacteria, pollution, and other particles before they reach the lungs. Imagine mucus as a filtration system similar to the water filter in your home. It works silently, all the time, protecting your body. The problem is not the existence of mucus. The problem begins when it stops being thin and fluid and becomes thick, sticky, and difficult to eliminate. That is when the unpleasant feeling of something stuck in the throat appears. And one of the most common reasons for this to happen is something surprisingly simple. The first cause is dehydration that many people do not even realize they have. Mucus is composed of about 97% water. This means that when the body receives little hydration, the secretion begins to become denser. Think about honey. When it is fresh and at room temperature, it flows easily. But when it gets cold or sits still for a long time, it becomes thicker and harder to move. Something similar happens with mucus. Many people believe they are well hydrated just because they do not feel thirsty. However, as the years go by, especially after the age of 50, the body's thirst mechanism becomes less efficient. In other words, you may be needing water even without feeling the desire to drink. A simple rule used in healthcare is to consume approximately 30 milliliters of water per kilogram of body weight per day. A person weighing 70 kilograms, for example, needs about 2 liters of water daily. Another important detail is that coffee does not replace water. On the contrary, caffeine may even increase the elimination of fluids from the body. Many people notice a significant improvement in mucus simply by starting the day with 2 glasses of water and maintaining constant hydration throughout the day. The second common cause of persistent mucus is related to the nose and is known as postnasal drip. This name may sound complicated, but the mechanism is simple. The nose naturally produces mucus to protect the respiratory pathways. However, when there is some type of irritation in the nasal mucosa, caused by dust, mites, pollution, temperature changes, or animal hair, the body begins to produce more secretion. Instead of running out through the nose, this mucus may slowly run down the back of the throat. That is exactly what we call postnasal drip. Many people do not realize this is happening. They only feel that accumulated mucus, especially when waking up. This happens because during sleep you remain lying down for several hours and the mucus slowly drains into the throat. When you wake up, the sensation of secretion appears more intensely. A simple and very effective practice to help in these cases is nasal irrigation with saline solution. It helps remove irritating particles, clean the nasal passages, and reduce inflammation of the mucosa. Another possible cause is something called silent chronic sinusitis. When we think about sinusitis, we usually imagine strong facial pain, pressure in the head, or fever. However, there is a more discreet type that does not present such intense symptoms. In this case, the sinuses remain inflamed for long periods, sometimes weeks or months, producing thicker mucus that slowly drains into the throat. The person may not feel pain, but lives with persistent mucus, frequent throat clearing, and the sensation of constant secretion. That is why many cases go unnoticed for a long time. There is also another cause that surprises many people. Some medications can contribute to throat symptoms. Certain medicines used for blood pressure, for example, can cause irritation of the respiratory pathways or persistent cough. Anti-inflammatory drugs may also favor another very common problem, which we will see next. In addition, prolonged use of nasal decongestant sprays can cause an effect called rebound, in which the nose begins to produce even more secretion when the medication is no longer used. But now we arrive at the cause that probably explains most cases of persistent mucus, and it is something that many people have without realizing it. Silent reflux. When someone talks about reflux, most people immediately think of heartburn or burning in the chest. However, there is a different type called laryngopharyngeal reflux, also known as silent reflux. In this case, small amounts of stomach acid rise up to the throat region without causing heartburn. Even so, this acid irritates the throat mucosa. As a defense mechanism, the body begins to produce more mucus to protect that area. The result is exactly what many people report: constant mucus, the need to clear the throat, mild hoarseness, or the sensation of something stuck in the throat. Often, the symptom appears mainly in the morning or after heavier meals. Other common signs include a bitter taste in the mouth when waking up or worsening discomfort after lying down soon after eating. Some simple behavior changes can help a lot in these cases. One of them is avoiding meals during the 3 hours before sleep. When you lie down with a full stomach, acid can rise more easily. Another strategy is to slightly elevate the head of the bed, using gravity to prevent stomach contents from returning to the esophagus. It is also worth observing some foods that may favor reflux, such as fried foods, excessive coffee, chocolate, alcoholic beverages, and very acidic foods. This does not necessarily mean eliminating all these foods forever, but testing a few weeks without them can help identify whether there is a relationship between them and the symptoms. There is also a very common habit that can worsen the situation without people realizing it: constant throat clearing. When you repeatedly force your throat to clear mucus, you end up irritating the mucosa even more. The body reacts by producing even more secretion, creating a cycle that is difficult to break. Instead of clearing your throat, it is often better to take a small sip of water and swallow slowly. Although persistent mucus usually has simple causes, there are situations in which it deserves medical attention. Seek professional evaluation if there is blood in the mucus, persistent fever, shortness of breath, unexplained weight loss, or dark secretion with a strong odor. If you have been living with this problem for some time, some simple measures can help a lot. Maintaining good hydration throughout the day, performing nasal irrigation with saline solution, avoiding eating right before sleep, observing possible food triggers, and reducing the habit of throat clearing are changes that many people report as extremely effective. If the mucus has persisted for months or years, do not ignore this sign. Often the body is just trying to show that something needs attention. Understanding the cause is the first step to solving the problem. Taking care of the throat may seem like a small detail, but it works for you all the time to breathe, speak, swallow, and communicate. And when something is not right, it always gives signals. Learning to listen to those signals can make a big difference in your daily well-being.